Hey everyone, it's Travis, and today I want to talk a little bit about pain, strength, and stamina after partial knee replacement. I had partial knee replacement about 7 weeks ago, so kind of look back on that. First thing, pain. It's going to be painful for most people anyway. Um, it's a very invasive surgery. You can sort of see here the incision that I had. They also have an anchor point down here where they hooked a robot to kind of guide everything. What they're basically doing, and the reason it's going to hurt for a long time, is they are removing bone. And there's just no easy way to do that. Whether it's, here's a visual for you, a hammer and a chisel, you know, busting bone away so they can put the new piece in there. There may be another fancier way of doing that, but regardless, it's going to hurt. They're removing bone and they're putting an artificial piece into your knee. So that's going to hurt for a while. Yeah, the pain, they will give you medication for that, probably give you something like OxyContin or Oxycodone, something like that, maybe with a secondary like Tramadol, which is what they gave me. If you have nerve pain with it, they may give you something like gabapentin. Every doctor is going to be different. These are just the ones that my doctor prescribed for me. I'm not on most of those anymore. I do take the gabapentin now. Anyway, one of the big things you can use is ice. They may give you an ice machine that you can like pumps the ice through a little pad that goes on your knee. Elevate, keep that knee up, especially at the very beginning. Keep it stable. They gave me a stabilizer one on my foot. My foot went in this little blue thing, and it kept my alignment correct. It's going to be real frustrating for most people to go through this. Everyone I've talked to says it's frustrating because you're going to think, I need to be healing faster than this. I've had injuries before. I was an athlete, or I did this and I did that, and I just bounced back from this. This is a hard one to bounce back from quickly. The estimates that I've heard, and I believe now that I'm 7 weeks into this, 6 months to a year before you're back to somewhat normal, and you may never be 100% like you were before. One of the doctors that I talked to said that you're shooting for about 80% of what a healthy knee would be like, best case scenario. I hope it's a little bit higher than that for me, but 80% is a lot better than where I was before, which was not able to walk hardly at all because I had, for the third time, a torn meniscus, and the last one looked kind of like a jagged knife sticking out of my knee or under my kneecap. So yeah, very painful. So take your medicine, stay ahead of the medicine, stay ahead of the pain. Don't get behind on it. Don't try to tough it out. Oh, I don't need this, I don't need that. Your body is going to need time to heal. Don't try to rush it. One of the worst things that you can do is try to push yourself too hard. Again, I may not look like it now, but I was an athlete back in the day, and it was one of those things, push through it, you know, pain is just weakness leaving the body, you know, no pain, no gain. And there's some truth to that, but if you're going to deal with your pain after a knee surgery, make sure your doctor and your physical therapist are the ones that are inflicting the pain and telling you what to do. You can actually set yourself back as far as your recovery goes by doing too much, by pushing yourself, and I've done it. I've pushed myself, I'm going to start taking a walk, and I'm going to walk a little bit further than I probably should have, and I did that for a couple of days, and I couldn't get ahead of the pain after that, and actually the physical therapist said, you need to stop, you're hurting yourself by doing too much. Listen to the pain and don't overdo it. One of the worst things you can do is talk to someone else who has not had knee surgery but knows a guy who did. Because there's all those, oh, I know a guy, or my cousin did this, or my next door neighbor. I've heard it from people talking about my knee. My wife has heard it talking to people. Oh, I know a guy that was mowing his grass again, push mowing after 3 weeks. Or I know this person here that did this and did that. And basically they're making you feel like you're a big wuss because you're not bouncing back like their friend who did. Don't worry about that friend. They're probably lying, honestly. Or they may not have had an option of staying home and keeping it elevated and doing the proper thing for rest for whatever their life circumstances may have been. So don't worry about that. Heal at your own pace. Everybody is different. I know people that, you know, talking to them in physical therapy, and they're like, oh yeah, I was on pain medicine for 3 weeks and then I was off of it. Well, here I am. I'll just tell you, 7 weeks later, I'm still taking this stuff. Not the hardest of it, but I can't get through the night sleeping without my Tylenol and without my gabapentin and with just a little bit of Tramadol. You know, honestly, I also, after my 6-week appointment, the doctor cleared me to use one of these concussion or whatever percussion massagers. Don't do the actual implement area, but you know, your muscles above and below. it's just going to be sore. It really is. Something else that the doctor advised me to get, you get this over the counter. This is Icy Hot brand, but it has lidocaine in it. So something with lidocaine in it. Again, don't put it on your incision spot, but put it, your thigh or your lower leg or wherever it may be. And finally, a knee brace. This is just a copper brand, but it doesn't really matter what brace it is. And again, don't get these without talking to your doctor first. Don't take medical advice from me. I'm just telling you about what my journey was. But a doctor said this will kind of help compress that, stabilize that a little bit, and help some of that pain kind of disseminate a little bit. So again, hang in there with that. The strength, I'll tell you, strength is hard because you've got to get your energy up. And your energy is going to be hard also because that goes along with that stamina. Your body is putting everything it has into healing your knee right now. All the iron, you may even be anemic right now. Talk to your doctor. Maybe you need to take a vitamin with some iron supplements or something like that, because every bit of energy is healing your knee right now, and that's just draining the rest of your energy. I'm now at 7 weeks able to go up and down stairs 1 foot at a time. The step, and then get your bad foot down, and step and bring your bad foot down, instead of like you would normally go up just like left, right, left, right, left, right. You put a lot of pressure on your knees going up and down stairs. Lowering yourself, I think someone says it's like 4 times your body weight or something like that of pressure on your knee, and going up it's like 8 times. I may have that reversed, but regardless, it puts a lot of pressure on your knees. So don't feel like, I need to go up and down stairs. I did, going up and down stairs trying to find the light for this camera, and I missed a part and I had to go down twice. And I had to wait a while because I broke out in a sweat, and doing stairs just wipes me out right now. It does. So your strength is going to come back eventually. The strength will probably start coming back first. Your stamina will probably be the last thing that comes back. So again, 6 months to a year before you may be back to what you consider to be normal. So hang in there. It's a long journey. Enjoy it. Honestly, just sit back, accept it for what it is. Don't feel pressured from anybody else to do anything. This is your journey. You do what you have to do to get well, because honestly, that's why you did this. You want to be able to do things. For me, I want to be able to play with my grandkids, and chase them around in the park and in the water park, and go to the lake and go fishing and swimming with them. I mean, these are the things that I want to do. Spend time with my family. I'm a couple of years out from retirement. I don't want to be hobbled when I'm on retirement. I want to be healthy. One of the reasons I've gained weight is I can't get out and do the things that I used to be able to do because I was hurting. So let's get this fixed. Let's get the weight loss going. For me, getting better shape afterwards. So anyway, that's the advice I have on pain and strength and stamina. So hang in there with it, and good luck on your journey.